Hayley from Foundation Podiatry. So capsulitis of the forefoot. Capsulitis refers to inflammation of a joint capsule. Now in the forefoot, that will normally be at the second metatarsophalangeal joint, so where the second metatarsal meets the toe, okay? Now often this joint will become inflamed compared to the other toe joints, and that's because it is, or should be, the longest metatarsal. So during toe off, it will cop quite a bit of a load and pressure through that toe joint, okay? Now, this will happen even more so if the second metatarsal is longer than what it should be, or the first metatarsal is shorter than what it should be. So some foot types that this is the case, meaning that the second toe joint will load up a lot more and become injured. Now, other reasons that we might get a capsulitis or inflamed joint at the second toe joint will be when the big toe doesn't work properly. So that's the bunions, the hallux valgus, the hallux limitus, the functional hallux limitus, where the big toe it does have range of motion, but it doesn't work properly during toe off, okay? Now, when this joint becomes inflamed, it makes it really quite painful to walk. You'll notice that it's during the mid-stance to toe off phase of walking that it will be sore, and you'll want to alter your gait, okay? So to treat it, we need to offload the joint to allow it to settle down. So that may be as simple as some padding with a hole underneath that second toe joint to deflect pressure. We may look at doing a metatarsal dome to help lift that toe joint and share the load across the forefoot a little bit better. Sometimes we may need to do a stiffening piece inside the shoe for a while, or even depending on the severity, maybe even a moon boot just to allow it to settle down. Other things that we can do to help the toe joint is things like laser therapy and needling, which assists with inflammation and calming it down, okay? Now, when this toe joint is sore, certain activities will be more sore. So if you're at the gym and you're doing lunges, so the back foot in the lunge, as soon as you're trying to bend that foot, it will become aggravated. If you're holding a plank, and again, we're flexing at those toes. Maybe if you're gardening and you're squatting down and you're wanting to try and bend those toes, that type of activity will stir it up, okay? So this sort of highlights the number of different problems that can occur in the forefoot, and it's important that you get the correct diagnosis because depending on the diagnosis will depend on how we would manage it. So that's another type of forefoot pain. I hope you find that helpful. Thank you.